Leadership is more of the practical applications of the different theories on how to handle stakeholders. That's very important. Stakeholder management is the most important aspect of leadership. That we should be able to balance what is being requested by your clients and what can your team members really deliver. Would put it into the simplest way again would be PPT, right? Three different aspects of leadership. It means that we need to be able to manage people, the process, and the technology. The people level, it means that we should be able to do proper people engagement. We should be able to understand behavior. Engagement is simply telling your team members that you can approach me anytime and I will be there for you if you need help, right? So process definition is very important. With healthcare will always be a complex process, right? And so we should be able to define those different steps in their process so that they know that they're doing the right thing. And then lastly, of course, is in our day and age, we should have technology leadership. As a leader, we should be able to leverage on what sort of technology can I incorporate into my process and into my team's capacity and capability so that I can help them give out the best quality in their work. And at the same time, aside from doing quality work, they should be able to give out the most number of charts that they can review, which is what we call productivity on a day-to-day basis. Um, in my experience, it's the experience, right? I think nobody is really born as a leader. It's similar to your nature versus nurture theory, right? I think you're working towards that definition, and some individuals would say your nature and you're born with it is something that you're really is an innate capability that you have, but as far as people management is concerned, you have to have that nurture capability, which means that um, you should be able to develop that through application. You can never be a true leader if you don't even know how to connect with your team members. And that in itself is social application of your theories, right? So you may have a lot of knowledge about how and what a leader should be, but if you're not, connecting with your team members, you're not connecting with your stakeholders. In this way, your facilities and hospitals, and of course your allied medical professionals. If you don't know how to really communicate with your colleagues, you're not able to really express the things that you need to express in terms of meeting the key performance indicators. That will not serve and help you being a leader. So in my situation, I would say leadership is something that's honed and developed over time. The most important characteristic of a leader is the ability to really engage, right? Engage. So if I'm the middle person, I should be able to engage with my leadership, the individuals whom I report to, but I should also be able to engage with my one down or even three or four downs, which means the individuals who report to me. The ability of the leadership to engage also means that you would be able to identify certain capacities and capabilities wherein you can delegate your task, right? Because if you look at leadership, you have to have three very important concepts in mind: strategic, logistic, and tactical leadership. Strategic leadership means that when your leaders, the individuals whom I report to, understand the way forward. How are we going to, um, say, for example, improve healthcare in our facilities, right? Which is a strategic question. We should be able to translate that strategic goal into something that's actionable, which is now your logistic and tactical. So when you say logistic and tactical, that's essentially engagement to your team members, right? And so, therefore, if you are not able to engage with your team members downstream, right, the people who reports to you, they would not be able to understand people, process, and technology simply because there was no engagement. Sometimes they call engagement as collaboration, right? A simplification of that term, ability to relate with each other, right? But I think engagement is more encompassing because it entails people engagement, process engagement, and technology engagement. Okay. I think the hardest part of the BPO industry leadership management is stakeholder management, right? And when we say stakeholder management, there is a mismatch between what are your clients expecting you to deliver and what can your teams or what can your teams actually provide, right? So a good example of that is an expected 100% quality. Let's just go down a bit, 95% quality, and a productivity expectation of 110%, right? It has happened to me quite a number of times already, where there's a mismatch between the productivity expectation of 110% when in fact your team can only deliver, say, for example, at 90%, right? So now that becomes a concern because there's a mismatch between what your facility, your hospitals are expecting you to produce in terms of the number of charts that you can abstract per day, and along with the quality of it, versus what your team members are able to deliver. I can't really go into the detail of it because I'll be divulging way too much information. But I think the bottom line there is one of the major significant concerns and issues that we encounter not only on a daily, monthly, quarterly basis, but also on a yearly basis or an annual basis, is really trying to determine the balance between what your clients are expecting you to do versus what your team members can really achieve and deliver. Okay, so you're talking about the people aspect of leadership, right? We need to make sure that we have proper domain expertise first, right? I think in all aspects or even any industry that we need to tackle, it's always domain expertise that comes first. By that we mean that you should have very reliable nurses, right? Medical technologists, very very good practicing physicians, right? So that's what you call domain expertise. But aside from domain expertise, again, we need to make sure that they have a good definition of what task they need to do. That's the goal. Now, once you have defined your domain expertise and, of course, the expectations from them, then you set your goals. Then the expectation is that they should be proficient in making sure that they are able to abstract 10 charts per day with quality and proper productivity expectation. They should have a very good definition of their job descriptions and expectations. Because without setting proper limitations, right, your teams will not have the ability to set themselves up to success simply because there's no target inside. This is similar to what we call in this industry a moving target. In most instances, we segmentize the different requirements that we need. And by segmentation, we mean that from a simple type of abstraction, they move to a, shall we say, medium complexity type of abstraction, and then eventually to the most complex type of medical abstraction. They should also be able to understand their developmental goals. Because without them knowing that if I do this, and I'm not really sure where will my current job description lead me to, right? Then they would not have the ability to have foresight on their professional career. So my understanding is that once you have given an individual specific professional uh, and career goals in their life, right? They actually deliver more than what they are expected to deliver because they know what are the next steps for me to do compared to the current process that I'm doing so that I can share and show leadership that I am now built for the next level in my career. Most important decisions. We always go back to those the previous concerns that I have mentioned, right? Stakeholder management, which means what are your clients expecting you to do, and of course, team or capacity and capability management. What can your team deliver? Most of the decisions is the whether to proceed with your current process because you know that there's a mismatch between your upper stakeholder facility management versus your team's capacity and capability to deliver, right? So the decision now is a go no go, right? Do I proceed with the job that my client is trying to give me, or should I just put a stop to it because my team members really cannot deliver? Now, there's where that balance of can I essentially bargain for something that's lower. So, in most instances, my decision is really to do some bargaining discussion with my facility so that they know that currently this is my capability and capacity. But give me 2 years, right? And I know we will reach your expected 90%, 95% quality at 120% productivity. Right? Very difficult decisions because you need to have a lot of data. You need to understand whether your team can really step up to the plate. You need to have and define the trajectory of how your team members can actually improve on their quality. You also need to define the trajectory of how when and how can I reach 120% productivity with my current 90% productivity so that you can commit to a specific timeline. This is where your team members will be able to help you identify, whether the decision really is to give a stop to the current process, do bargaining with your clients, or simply just commit and say, okay, I will do that in a month's time. Right? success will always have different phases, right? Or even different definitions. But for my medical abstraction process, success is the ultimate definition of goal, right? So if you have set specific goals, again, going back to productivity and quality capability, if you're setting your team to 120% productivity at 95% quality day in, day out for the next 6 months, and your team was able to reach that goal, then that is a success, a measure of success. um, Success will always have subjectivity, and in most instances, it's really hard to define whether you are successful to a particular project, right? But we always need to define what's in scope and a target so that we can actually say that we are successful in our goals. Because without targets and goals, it's going to be hard to define whether you are successful. The biggest challenge leaders face today. It's always, from my end, it's always engagement because it's really hard for me to understand how Gen Zs and millennials think. I'm not sure if you know my age, but I think you know somehow because my daughter is of your age too, right? And so trying to get the balance and trying to understand how Gen Zs and millennials think and what we need to deliver as leaders is something that we always need to keep an eye on. Sometimes we lose track of the fact that you're expecting something from a or somebody of your age, right? But you're probably doing it the wrong way, simply because millennials and Gen Zs have different ways of looking at work, right? We need to understand how we can engage our team members, also not just based on their generations or age, right? But we also need to understand where are they coming from, right? Like say, for example, if you have a nurse, right, who has been very successful with her career as a clinician and practicing for say 10 years in a private hospitals and is now a shall we say a clinical instructor, right? And then move towards the BPO industry, not just because the BPO industry is offering a better financial capability. Um, if we don't have a good understanding of how that nurse is looking at her goals and career, then it's going to really be difficult for us to engage with our team members. So again, it all boils down to the fact that as a leader, engagement, team engagement, stakeholder engagement is and should be on top of our list.
Good day, panelists and Mr. Dulay. We are the Group 5. I, Chanel Ashley G. Pineda, together with my group mates,
Joy Antonio.
Gian Carlos Coso.
Anne Margaret De Leon,
Huy Alvin.
Baby Rose Ignacio,
Irish Carteret.
And Josiah Ramirez.
and today we are going to present the insights we gathered from our leadership interview with Dr. Dexter Alcantara, the Senior Director of Tenet Healthcare Philippines.
For our presentation's objectives, first, overview of the interview. Second, background of the interviewee. Third, roles and responsibilities. Fourth, background of the company. And lastly, effective leadership insights.
To give an overview, the interview happened last October 30, 2025 via Zoom platform. The meeting link was sent to Mr. Dexter Alcantara, the interviewee, one day prior. The discussion lasted approximately 32 minutes, covering topics related to leadership and management style.
To introduce our interviewee, Dr. Dexter Alcantara, a physician with a diverse background in healthcare. He started his career serving as a medical officer for the government in Antipolo, later moving into emergency medical evacuations, where he handled both local and international patient transfers. He eventually transitioned into the BPO healthcare industry, taking on roles in utilization review, workplace management, and now medical abstraction with Tenet Healthcare. Through this experience, Dr. Dexter has developed a leadership style grounded in adaptability, responsibility, and purpose. For him, effective leadership means staying composed, understanding people, and guiding others towards a common goal.
Dr. Dexter served as the Senior Director of Operations for Tenet Healthcare in the Philippines, where he oversees a team of around 400 full-time employees. His team is composed of allied medical professionals, including nurses, medical technologists, pharmacists, psychologists, psychometricians, radiology technicians, nutritionists, and even fellow physicians. In his role, Dr. Dexter ensures that his teams deliver two major functions: medical abstraction and infection prevention surveillance. He makes sure that every patient chart they review captures all the information required by the Center for Medicare and Medicaid Services. Accuracy and attention to detail are crucial, as this information helps determine whether U.S. hospitals under Tenet provide the highest quality of patient care. Although his entire team is based in the Philippines, they support and serve multiple US-based hospitals, ensuring consistent, reliable, and high-quality healthcare data.
To give an overview of the company where Dr. Dexter Alcantara currently works, Tenet Healthcare is a major health organization in the United States that relies heavily on its Philippine team to manage critical administrative and support functions for its American hospitals. Their core responsibility is conducting detailed quality checks on patients' medical records, both current and historical, to ensure that all treatments and procedures meet the highest medical standards and comply with official regulations. These reviews are essential for maintaining compliance with the Centers for Medicare and Medicaid Services, or the CMS, the U.S. government's healthcare regulatory body. Through the work of over 400 highly trained medical professionals, including nurses, doctors, and medical technologists, the team ensures data accuracy and completeness, helping Tenet consistently maintain accreditation and deliver top-tier healthcare across its facilities in the United States.
Moving forward, for Dr. Dexter, effective leaders build strong foundations by focusing on four key areas. First, empathy and guidance. Leaders must understand their team members' strengths and weaknesses. Second, clear systems. This means having structured processes ensures that tasks are completed consistently, accurately, and efficiently. Third, the smart use of technology, such as integrating modern tools, data management systems, or simple software. Finally, the ultimate goal of effective leadership is to deliver consistent, high quality results. By balancing people, process, and technology, leaders can create a strong foundation that drives the team success and organizational excellence. Moreover, he also defined leadership as a balance of people, process, and technology, which he referred to as PPT. Managing these elements effectively ensures quality performance. The people aspect refers to the team members, their skill, motivation, and engagement. For him, leaders must understand their team's strengths and weaknesses to provide proper guidance, support, and training. The process aspect involves creating clear, structured, and efficient workflows. Dr. Dexter compared this to building a house. Without clear steps and the right tools, the result will be unstable. In leadership, this means defining clear procedures, responsibilities, and goals so that everyone knows exactly what to do and how to do it. And lastly, the technology aspect, which focuses on using modern tools and systems to enhance productivity and performance. Dr. Dex emphasized that leaders today must know how to integrate technology. When used effectively, technology helps teams work faster, minimize errors, and maintain high quality results.
Dr. Dexter explained that leadership is mainly developed through experience rather than being innate quality when you were born. This means that it is a developed skill over time because for him, while some people believe traits like confidence or good communication skills are natural, he emphasized that successful leadership depends on developing skills through practice. Leadership involves more than theory and it requires real world application, including connecting and communicating effectively with team members, colleagues, and stakeholders in the workplace. Without this connection, reaching important goals is difficult. So he believes that leadership is a skill that matures over time through experience, reflection, and learning.
According to Dr. Dex, the three important characteristics a leader should possess, which are strategic, logistic, and tactical leadership. First, a leader must have vision. Strategic leadership is about understanding the way forward. As Dr. Dex explained, leaders need to know the direction of the organization and what long-term goals need to be achieved. Vision allows them to guide others toward that future. Another characteristic a leader must possess is the ability to translate strategy into action. Dr. Dex mentioned that after identifying the strategic goal, leaders must convert it into something actionable. This involves organizing processes, identifying capabilities, and making sure that the plan is realistic and executable. This translation skill is what makes logistic leadership effective. Lastly, the key characteristic is engagement. According to Dr. Dex, engagement is the most important trait overall. Tactical leaders work directly with the people who carry out the task, so they need to able to connect, collaborate, and communicate with their team. Engagement helps them understand people, processes, and technology on the ground, and allows them to delegate and support their members properly.
Based on our interview, one of the major challenges Dr. Dexter faced was the management of stakeholder expectations. In the healthcare BPO setting, U.S. hospital partners usually set productivity and quality standards that exceed the prevailing capacity of the local teams. It creates a situation where the expectations are very high, while the operational resources may not be fully aligned yet. A leader himself, he needs to negotiate expectations continuously, give realistic performance projections, and ensure that targets remain within reach without sacrificing employee welfare or output quality. He has to balance the demand from the clients against the actual capability of his staff. The broader context is that today, the major challenge that leaders face is to lead a diverse workforce that is continuously evolving. Generational differences, like millennials and Gen Z, reshape workplace values, communication styles, and motivations. Today's workforce is looking for clarity, engagement, meaningful work, and psychological safety, which means leaders need to adapt to changing leadership styles and enhance emotional intelligence. The technological advancement and rapid organizational changes will require leaders to be flexible, data driven, and people oriented. All in all, today's leaders need to work within a complex environment where understanding people, fostering adaptability, and aligning goals with capability become critical to sustaining performance.
For Dr. Dexter, success in leadership is never vague. It must be measurable, clear, and tied to specific goals. He explained that in a complex field like healthcare, success cannot be based on feelings or assumptions. Instead, it is achieved when the team consistently meets the set productivity and quality targets. For example, if the goal is 120% productivity and 95% quality for 6 straight months, and the team is able to reach and sustain those numbers, then that is what he considers true success. He emphasized that leadership success demands clarity. Without targets, it becomes impossible to define whether a leader or team is actually succeeding. Ultimately, for him, success happens when goals are clearly defined, expectations are realistic, and the team is empowered enough to consistently reach those goals.
When it comes to motivating and empowering his people, Dr. Dexter uses a structured and human centered approach. First, he makes sure that every team member has strong domain expertise, whether they are nurses, med techs, pharmacists, or physicians. He believes that the confidence comes from competence. Second, he ensures that each person clearly understands their job expectations, including their daily targets. According to him, unclear goals or a moving target can demotivate employees. So, he sets specific achievable goals, like how many charts they need to abstract per day so they know exactly what success looks like. Third, he empowers them by giving the developmental and career pathways. He explained that people perform better when they see a future in the organization. When an employee knows that their work can lead to promotions or specialization, they become more motivated and engaged. Overall, he motivates his team through clear expectations, strong skills training, career growth opportunities, and consistent support and engagement. For Dr. Dexter, empowering people means helping them grow not just as workers, but as future leaders of the organization.
To conclude, our interview with Dr. Dexter Alcantara highlighted that effective leadership is built on adaptability, responsibility, and understanding the people you work with. His experiences showed us the importance of clear goals, composed decision making, and empowering teams to achieve success. These insights will guide us as future professionals and leaders. And that ends our presentation. Thank you and good day.